Do you know what anemia is? It's a medical condition where your blood lacks adequate healthy red blood cells. These cells are crucial in transporting oxygen to your organs and tissues. Their absence or malfunction deprives your body of the essential oxygen. But what this deficit? Let's delve into it. Anemia has numerous causes, all affecting the count of red blood cells. These causes fall into three categories: decreased production, heightened loss, or destruction of these cells. The first category, decreased production, can result from a simple deficiency of nutrients required to produce red blood cells. Essential nutrients like iron, folate, and vitamin B12 are vital for the production of red blood cells. A deficiency in these nutrients can lead to your body being unable to generate the required amount of red blood cells. This could result in iron deficiency anemia, which is the most prevalent type of anemia. Moreover, chronic diseases such as kidney malfunctions and cancer can lead to a decreased production of red blood cells. This is due to the interference of these diseases with the body's cell generation process. There are also certain conditions that are genetic in nature, like aplastic anemia, which leads to the body underproducing red blood cells. Additionally, there exists a genetic disorder called thalassemia, which results in the production of an abnormal form of hemoglobin, the protein in red blood cells responsible for oxygen transport. Transitioning to our second category, which is the increased loss of red blood cells, it's an important aspect to understand. This condition usually occurs due to bleeding, a common consequence of various circumstances in life. This bleeding could be due to an unexpected injury, such as a cut, a bruise, or a more severe wound. Alternatively, it could be the result of heavy menstrual periods, an issue that many women encounter, particularly during their reproductive years. An additional cause could be gastrointestinal bleeding, a serious condition that often demands immediate medical attention. As we venture deeper into our understanding of anemia, let's outline the key symptoms. Foremost, fatigue due to reduced oxygen supply. Second, pale or yellowish skin from a lack of red blood cells. Third, irregular heartbeats as your heart compensates for decreased oxygen. Fourth, breathlessness, signaling oxygen deficiency. Lastly, pica, an unusual symptom where you crave non-food items, suggesting your body needs more essential nutrients like iron. These symptoms shouldn't be ignored. If you're experiencing them, consult a healthcare professional for proper diagnosis and treatment. Remember, early detection is key when dealing with conditions like anemia. In conclusion, the third category, which is the destruction of red blood cells, plays a vital role in the body's overall health. This process, although necessary, can become harmful when it gets out of balance. The body always aims to maintain a delicate equilibrium, producing new blood cells at the same rate it destroys old ones. However, specific medical conditions can disrupt this balance, leading to adverse health consequences. One such condition is sickle cell anemia. This genetic disorder causes the body to destroy red blood cells at a faster pace than it can replenish them, resulting in anemic conditions. Now, you may be wondering, how do doctors diagnose anemia? Well, allow me to explain the intricate process. Initially, physicians tend to undertake a simple but effective method which involves a blood test. This test isn't complicated. It involves drawing a small amount of your blood, which will then be studied in detail by a qualified lab technician. They will scrutinize the blood sample, assessing the number of red blood cells and their hemoglobin levels, among other factors. However, in some instances, a blood test may not provide all the necessary information. Here, more comprehensive procedures into play, such as a bone marrow biopsy. This is not a routine procedure and is typically reserved for specific cases and conditions. It's a bit more invasive than a blood test. In this procedure, a small sample of bone marrow is meticulously extracted from your hip bone. This sample is then thoroughly examined under a state-of-the-art microscope by highly trained professionals. The bone marrow biopsy is instrumental in diagnosing certain rare types of anemia, which might not be identifiable through a standard blood test. Such types include aplastic anemia and myelodysplastic syndromes. These are complex conditions that require a closer look at your bone marrow to determine their presence and severity. It can help diagnose rare types of anemia, such as aplastic anemia and myelodysplastic syndromes. Once diagnosed, treatment for anemia hinges on the root cause. Various forms of anemia exist, each bringing unique challenges in treatment. For example, anemia triggered by nutritional deficiencies is typically straightforward to manage. It might be as simple as integrating supplements into your daily regimen. These could be iron supplements, folate, or vitamin B12 tablets, depending on the deficiency detected. These essential nutrients assist in the production of healthy red blood cells, hence counteracting conversely for anemia caused by chronic diseases such as kidney disease or cancer. The treatment plan is more complex. Here, the focus might be on treating the primary disease triggering the anemia rather than anemia itself. This could involve different therapies or medications designed to manage the particular chronic condition. For severe cases, especially those where the body cannot produce enough healthy red blood cells, treatment might necessitate more drastic measures. This may involve blood transfusions or procedures like a bone marrow transplant. To sum up, anemia is a condition where your body lacks the sufficient number of healthy red blood cells to carry oxygen to your body's tissues. This situation can lead to fatigue and weakness. There are different types of anemia and cause varies for each. Some anemias are hereditary, while others may occur as a result of certain diseases, conditions, or lifestyle choices. One of the most common causes is the deficiency of iron in the body. It can also arise due to a decrease in red blood cell production, an increase in red blood cell loss, or a destruction of red blood cells. The production red blood cells can be impacted by a low iron or vitamin intake, exposure to certain toxins, chronic diseases, or a genetic disorder. The loss of red blood cells can happen as a result of heavy periods or bleeding ulcers, while destruction of red blood cells can occur due to infections, drugs, or diseases, such as lupus or malaria. Diagnosis typically involves a comprehensive blood test, which can reveal the number and appearance of red blood cells, or, in rare cases, a bone marrow biopsy may be performed. Treatment greatly depends on the underlying cause. It can range from simple dietary supplements to correct deficiencies, to medications that can stimulate red blood cell production, to blood transfusions or bone marrow transplants in severe cases. Understanding anemia is the first step to managing it, so remember to consult with a healthcare professional if you suspect you might be anemic. In cases of severe iron deficiency anemia, oral iron supplements may not always suffice. This is when intravenous iron infusion becomes crucial. It's a treatment where iron is directly delivered into the bloodstream. This approach is used when oral supplements fail or aren't tolerated well, or before surgeries involving significant blood loss. The benefits substantial. It rapidly boosts the body's iron levels, aiding in the production of more red blood cells. This can alleviate common anemia symptoms like fatigue and breathlessness. However, there are potential side effects such as headaches, muscle pain, and allergic reactions. In rare instances, serious complications like iron overload may occur. Therefore, it's essential to consult your healthcare provider before opting for this treatment. Always remember, your health is in your hands, and being informed is your best defense.